Welcome back to Today's Health. In this segment, I'm speaking with board-certified interventional cardiologist, Dr. Bashar Samman. Dr. Samman, thank you for speaking with us today.
Thank you for having me.
Now, Doctor, you have been performing procedures and diagnostic testing at McLaren Port Huron for many years. Can you tell us more about yourself and the other doctors and professionals on the heart team there?
Sure. About myself, I moved to this area about 23 years ago. I trained on the East Coast, came in over here, started practicing general cardiology and interventional cardiology with the group, the Port Huron Cardiology Associates. Our group started 30-some years ago. It's been around. We have the full gamut of cardiac care from general cardiology, interventional cardiology, electrophysiological studies, and peripheral disease. We're very lucky to have the whole spectrum of cardiac disease covered in our community. It helps us and helps our patient. It gives me the opportunity to be able to get the opinion of one of my partners if they have a specialty in a certain field in cardiology. And at the same time, it helps our patient to be able to see and be treated for all aspects of their disease. At the same time, we're very lucky because when we practice cardiology, it's not in vacuum. It's not only cardiac care alone. We depend on the people that we work with a lot, and they depend on us. It's a continuum starting from the patient coming from the emergency room all the way to the time they leave the hospital. So we're very lucky that we have a great support team, starting from the emergency room, to the pulmonologist we have in a hospital, to the critical care physicians, if need of surgery, our surgeon, our anesthesiologist, in addition to the great support from nursing staff, our physical therapist, everybody. So it makes life much easier, not only for the patient, but for us as well. As a physician, when you want to practice somewhere, and all of us, when we finish training, we looked at different places, where do you want to go? And one of the things you look for is not only, is it a busy place, but do I have the support to be able to do what I would like to do, take care of my patient in the best possible way. And I believe that we're able to do that in Port Huron.
It sounds like there are a number of professionals that are involved in the care of heart patients at McLaren Port Huron. How is this an advantage for those who choose to have their treatment here?
It is, you're absolutely right. It's not, it's not only the cardiologist that's in charge. Everybody is part of the team. There's the closer team and the larger team, if you want to talk about it. And the advantage in Port Huron, as I mentioned earlier, we have all aspects of the care that we need available to us. We can consult anybody that we believe should be involved in the care of the patients. We have a great group of cardiovascular surgeons. The critical care and pulmonary care services is outstanding. We have the infectious disease, we have the emergency room. And it's important because when a patient comes in through the EMS, through our hospital, we depend on our emergency room physicians to tell us what's going on and where should we go. That's the first person who's going to meet the patients. Then we depend tremendously on nursing staff, the staff in our lab, the staff in the ICU, and the physicians.
Doctor, tell me more about the testing and treatments that are performed at McLaren Port Huron in the cardiac cath labs.
We are lucky to be able to give our patient the whole spectrum of cardiac care. And in general, if you want, we divide it into big pieces. One of them are what we call non-invasive testing. And that includes doing an echocardiogram or an ultrasound, which will help us look at the muscle of the heart, the valves of the heart. Then we have stress testing, either pharmacological stress testing or treadmill stress testing, either echo or nuclear, and that will help us see if there's any signs of blockages, lack of blood flow. We have the ability to monitor our patient to see if they have any irregular heartbeat. And then we talk about the invasive part, and that means doing cardiac catheterization, find out if there's blockages in the arteries. We're able to do an angioplasty and testing. In regard to the irregular heartbeat, the arrhythmia, we're able to do EP studies, we're able to put pacemakers, defibrillator, do ablation. So the whole spectrum of cardiac care, we're very lucky to be able to deliver in our community.
Now, when most people think of the heart and serious heart conditions, they think about a heart attack. What do people need to know or remember about heart attacks and treatment?
Well, heart attack is one of the diseases of the main disease of the heart. There's other disease, but definitely it's the one that pops up number one. Heart attack means there is an area of the heart that's not getting enough blood. And most commonly because one of the arteries that feed the muscle of the heart. And the muscle is a pump. And the whole idea of whatever we do is to keep that pump working at the best possible ability. If one of the arteries of the heart is blocked off, then not enough blood and oxygen is going down to that segment. And the quicker we intervene to restore the blood flow and the oxygen, the better the chances for the muscle to survive. So what do we need to know as a person that if I have anything, what should I do? Well, the first thing is the symptoms. And what I mean by symptoms is discomfort in the chest, going up to the arm, going down to the arm, up to the jaw, feeling short of breath, sweaty, nauseated. And at the same time, we worry about it in people that have a higher risk of heart problem. Meaning, if I'm a smoker, I have diabetes, I have high blood pressure, high cholesterol, a very strong family history of heart problem, my risk of having heart disease is much higher. It doesn't mean that I will not get heart disease if I don't have this. But definitely, if I have those risk factors, I have to be very careful. If I have symptoms that are not normal, there's something different, then I should seek attention right away. Why is it important? The longer we wait between the time that we're not having good blood flow to the muscle and the time we intervene, the less the chance to restore the muscle, and the damage will become permanent. So the whole idea about everything we do is speed in that aspect. As a term we use, time is muscle. So the quicker we can intervene, the more we're going to prevent any permanent damage to the muscle. And that's why the continuum of care that we have between the EMS, the emergency room, the cath lab team, and the physicians, that's where it's important, because that's a fast track that we can really get our patient taken care of in the fastest possible situation.
Dr. Samman, this has been great information for our viewers. Do you have any closing comments?
Well, I believe, not because I work here or live here, I believe we're very lucky in our community. We have a great group of physicians, and I'm not talking about cardiology only. We have a great group of physicians that are willing to take care of their patient. They're excellent, they're in town, the care is in town, and the care is close to our home. And the care is equal to the care in other places. I know what's done in other places because I worked in other places and I have friends in other places. And I don't believe that our quality of care in 99% of the diseases that any one of us will face is any less than anywhere else. So I think we're blessed in having that. And I'm only hopeful that we'll only continue to improve, because medicine in general is ongoing. It changes every day. It's always a challenge to learn something new, and hopefully we'll continue to.
Doctor, this has been great information. Thank you for joining us today.
Thank you.
Stay with us. We'll be back after this break.